How to survive med school anatomy lab smell. If you are stepping into an anatomy lab for the first time, you might be wondering how to handle the strong smell that comes with it. The odor primarily comes from formaldehyde, a chemical used to preserve cadavers. This substance has a very strong scent and can irritate your respiratory system, eyes, and skin. Understanding this can help you prepare for your time in the lab. First, it is helpful to know that cadavers are preserved in a solution called formalin, which contains formaldehyde. This chemical slowly releases vapors into the air, which is why the smell can be overwhelming, especially in spaces that are not well ventilated. Most anatomy labs have ventilation systems to help reduce the concentration of formaldehyde, but some exposure is unavoidable. To manage the smell effectively, here are some practical tips you can use. One option is to apply mentholated products, like Vicks VapoRub, under your nose. This can mask the formaldehyde odor and provide a refreshing sensation. The effect usually lasts about an hour, so you can reapply it as needed during your lab sessions. Another strategy is to familiarize yourself with the anatomy and structures before entering the lab. This preparation can help reduce anxiety and allow you to focus on learning rather than being distracted by the smell. Wearing personal protective equipment is also essential. Always put on gloves and lab coats, and consider wearing masks if your school recommends it. Masks with activated charcoal filters can help reduce the inhalation of formaldehyde vapors. If possible, try to position yourself near ventilation outlets. These areas typically have lower concentrations of formaldehyde, making it easier to breathe. Taking short breaks can also be beneficial. If the smell becomes too much, step outside for a few moments to breathe fresh air and reset your senses. Staying hydrated is important too, as drinking water can help alleviate some irritation caused by the exposure. Using protective eyewear can also reduce irritation from the fumes. Lastly, it can be helpful to mentally prepare yourself for the experience. Accepting that the smell is a normal part of the learning process can help ease any discomfort you might feel. Always remember to follow safety protocols to minimize exposure. Prolonged inhalation of formaldehyde can lead to respiratory issues and other health risks. If you experience persistent symptoms, be sure to report them to your medical school's occupational health services. By combining these practical measures, masking the smell, using personal protective equipment, staying near ventilation, and preparing mentally, you can better manage the anatomy lab environment and focus on your essential learning.